Thank you very much.
Shinde. I am a senior medical social worker in the hospital. Patient Mr. Yogesh Chaudhary was admitted in Navneet High Tech Charitable Hospital, Dahisar, on 29/1/2026 for road traffic accident. So I think there was a सीमेंट का जो गाड़ी रहता है वहाँ से उनको प्रॉब्लम हुआ था, इसलिए उन्होंने वहाँ पे 29/1/2026 को एडमिट किया था वो योगेश को. Patient's mother approached medical social worker on the 12th of February. We had given the list of documents to the patient's mother on 12th February itself. As per the allegations, bed was never denied to the patient as per the allegations. Myself, I coordinated with Dr. Sushil Nehte and Navneet Hightech for the present medical history of the patient. Dr. Nehte then spoke with the concerned authorities with the concerned consultant in Navneet Hospital. Patient mother was again asked to submit certain documents and the discharge this summary report from the concerned authority of Navneet Hospital, which are required for transferring the patient to Lilavati. Patient's mother submitted the summary on 13 February 2026. Summary was sent to Dr. Nehte. After speaking with the concerned authority consultant in Navneet, Dr. Sushil Nehte sent a message to me that the patient can be transferred to Lilavati. This message was conveyed to patient's mother, and on the 13th itself, she came to Lilavati again on 14th, but did not submit any documents. The patient was transferred on 15th, that is Sunday night. On humanitarian grounds, I did not verify any documents, but we admitted the patient. And then patient came around 7:30 in the casualty and was shifted to the ward at around 8 p.m. Within half an hour, we have shifted the patient from casualty to the ward. This I would like to clarify. And the patient is still on bed number 770, and the treatment is going on for the patient.
I'd like to introduce you all to Dr. Sushil. He is an eminent doctor of Lilavati Hospital and he is treating this patient, Mr. Yogesh.
Patient was transferred to Lilavati Hospital on 15th of February.
Actually, we were getting a lot of complaints from doctors. We were getting a lot of complaints from HODs. The entire thing started on 12th January when we had a board meeting in which we ratified the minutes of the previous board meeting. So when the trust office, which is headed by the chairperson, that is my mother, Mrs. Charuben Mehta, passed the minutes of the meeting of the previous board meeting, the minutes were passed with to all the board of trustees. That's the time when Mr. Rajesh Mehta gave out another set of forged and fabricated minutes which were apparently bearing the signature of Mr. Paramveer Singh. Now, at the onset, let me make it clear, Mr. Paramveer Singh, although he was paid fabulously, at the end of the day, he was an employee of the hospital. So he had no authority, he had no right, nor was he given any power by any of the board of trustees to authenticate or sign on any board of minutes. So by merely him signing the board of minutes, does that make the minutes tendered by Rajesh Mehta authentic? And are we trying to say the 10 trustees who have authenticated the minutes, are they liars? I mean, it's as clear as that. Then we started finding out that apparently Paramveer Singh had started extorting money from doctors, which of course which we are still investigating, but certain doctors came on air on Republic TV, and they have even confessed to it that yes, they were subject to harassment by Mr. Paramveer Singh. Now, very strangely, this meeting, which happened on 12th of January at around 11:30 in the morning, Mr. Paramveer Singh and Rajesh Mehta come in at 8:30 in the morning, which is a little strange because they never turn up to the hospital before 12:30. They coax 7 to 8 trustees to sign on blank papers their signatures, and the paper which is on top of their signatures is a letter bearing the facts which were not shown to these people, that these 7-8 HODs have full faith in Rajesh Mehta to become the managing trustee, the CEO, and the president of the hospital. These 7 HODs, after learning what had transpired, yes, they have given us retracting statements. But see the plot. It's very clear that Rajesh Mehta with Preeti Patil and Paramveer Singh wants to usurp the hospital, throw out and disband the board of trustees, malign them. Then after a few days, we find out that Mr. Paramveer Singh, in concert with Preeti Patil, although having no locus, files in a 41D in the charity commissioner to remove the board of trustees and appoint them as administrators. Now, how can employees who are working for the hospital be appointed as administrators of the said hospital? So all this is all concocted, and it's a poorly spun, Bollywood script by Rajesh Mehta and by Paramveer Singh to hijack the trust, to malign the trust, and to probably put in an administrator so that they can then run the hospital. And we have heard from very reliable sources that both Rajesh and Paramveer Singh ultimately want to sell the hospital, which neither the chairperson nor the majority of the board of trustees will ever allow. This institute, which has been running for 3 decades and serving the people of Bombay, India, and patients all across the world, ever to go in the wrong hands. Thank you very much. You all to have a talk and conversation with Mr. Yogesh's mother. She has kindly accepted to join us today, and you can talk to her. I'm sure she'll probably talk in Hindi.
He had come, he had presented to us, is far better compared over last 10 days, and he should be healing very fast.
I'd like to continue here. Mr. Aki Khatib, who is a social worker and runs the YouTube news channel, has chosen to publicly allege impropriety not merely in the patient, Mr. Yogesh, but also in relation to alleged financial frauds concerning the hospital and the trust. He has invoked political affiliation and suggested escalation into legislative forums. He has influenced patients to talk negative about the hospital and trustees by giving false promises and influences. This shows that there are creditable grounds to believe that Mr. Aki is acting at the behest of vested antitrust elements, including ex-permanent trustee Rajesh Mehta, Miss Preeti Prashant Patil, and Mr. Paramveer Singh, against whom we have initiated legal action of siphoning of more than 100 crores of trust funds. I want to put on record today that Leelavati Hospital is this year we will be completing almost 3 decades of successful running. Leelavati Hospital has stood the time, the trust, and the patient bearing confidence since 3 decades, and we continue to do so till the end of time. Today, Leelavati is bearing the fruits what my late grandfather and my late father, including my mother, who is the head chairperson of the Board of Trustees, with the efficient working of the Board of Trustees, is doing. Leelavati, in the last 2 years, after my mother took over control of the Board of Trustees, has taken Leelavati to exceptional heights of confidence for medical and creditable patient care. Today we have tied up with JCI, which is a Chicago-based company, where normally hospitals take anywhere between 10 to 13 months to achieve to get this award. We got this award because of the guidance of my mother and the strong influence of the doctors and the HODs in flat 97 days. So the talks what are being concocted by a lot of people through the medium of Rajesh and people like Paramveer Singh and Preeti are extremely frivolous and bogus. We are doing exceptionally well. We are doing almost close to 96-97% occupancy, which for a hospital is wonderful. Now, talking about fraud and malfeasance and misfeasance, it's actually the other way around. The Board of Trustees decided that the actions conducted by Mr. Paramveer Singh and Rajesh Mehta were completely antitrust. They siphoned out money through bogus billings. Now you'll probably ask me, Mr. Mehta, do you have facts to substantiate this? I will absolutely ascertain this, that the CFO and the second in charge of the accounts department have gone through the accounts, and they have given us statements written in emails and written in letters, where it is categorically said that Rajesh Mehta's, under his instructions, these bogus bills were made, which appear to be bogus right now, because at that point of time we did not realize it was bogus till we verified with the vendors. And today it's ironical that because of these misadventures of playing around with the trust and doing antitrust activities, when Paramveer Singh and Rajesh Mehta were unanimously thrown out by the Board of Trustees, today they are blaming the same thing on the trust, which is very ironical. I am putting them on strict note that if they are saying that they have got proof against us trustees having misfeasance, malfeasance, to produce them in courts. We are in the courts right now. We are right now also regarding Mr. Aki, Rajesh Mehta, and Paramveer Singh and Preeti Prashant Patil. We have filed a case of 1,000 crores against all of them, which clearly denotes and signifies that we are the aggrieved party, and today these people are crying hoarse that they are the victims allegedly, which is not true.
काय झालं होतं मुलाचं ऍक्सिडेंट कसं झालं तुमच्या
मी गावाला होते सर.
हा.
मुलगा इकडे 3 महिन्यापूर्वी कामाला आला.
हा, कुठे काम करत होतो
ते वराडा काही असं सांगितलं होतं, मला ते सांगताय. रातपाळी ड्युटीला गेला होता, आता सकाळी 7:30 टँकरवाल्याने मागे
जवळ घे, माईक जवळ घे.
मागे लेबर घेतली.
हा.
तो असा उभा होता बुवा, त्याला काही माहिती नाही पडला. दोघं पायानं त्याचं मागचं चाक,
दोन्ही पायावर चाकरी गेली.
दोघं पायानं.
मग त्याला कोणी ऍडमिट केलं हॉस्पिटलमध्ये
ते तिथल्या लोकांनीच ते कुठलं सरकारी हॉस्पिटल तिथून म्हणजे लांबचा नातेवाईक होता तो आले त्यांनी रेस्ट
लीलावती हॉस्पिटल कसं माहिती झालं तुम्हाला?
आम्हाला असं बाजूला एक पलंगवर हे होतं ना, त्या लोकांनी आम्हाला माहिती सांगितलं होतं बुवा पैसा पण नाहीये बुवा, एवढं खर्च झाला तर इथं फरक नाही तर तुम्ही तिथं जाऊन बघा बुवा असं सांगितलं.
मग तुम्ही कधी आला लीलावती हॉस्पिटलमध्ये? तारीख तारीख तर मॅडम
तारीख एवढं नाही माहिती, पण ते सांगितल्यानंतर मी 1-2 दिवसांनी घेत होती.
आता लीलावती हॉस्पिटलमध्ये ट्रीटमेंट डॉक्टर करतात ते.
हो.
तर आता तब्येत कशी आहे?
चांगली
चांगली आहे.
हो, चांगली आहे.
सर्जरी वगैरे व्यवस्थित झाली आहे.
हो, चालेल. त्याच्यातलं मला काही कळत नाही, पण चांगलं आहे मुलगा. चालू आहे ट्रीटमेंट.
गाव कुठलं तुमचं?
धुळे.
धुळेवरून आले.
हो. धुळ्याहून मुलगा आलेला होता.
मुलगा आलाय. तुम्ही पण धुळ्यात तुमच्यासोबत कोण
मी
आलं?
धुळ्यालाच राहते.
तुमच्यासोबत कोणी आलंय अजून?
नाही, मी एकटी आहे.
एकटीच राहते. घरी कोण कोण असतं?
तरी मुलगा आणि मी.
मुलगा किती वर्षाचा आहे?
35-36
लग्न झालंय?
नाही म्हणून तो इकडे आला.
Lilavati Hospital on 15th of February. Before that, I talked to the treating plastic surgeon who was treating him in Navneet Hospital and got to know about the details of injury and how it happened and what is the extent of injury. So 15th evening when he came, he was running high fever. His hemoglobin was low, his BP was on lower side, his heart rate was very high. So it was all suggesting that he might have gone into sepsis. So me and physician, our infectious disease specialist, gave him lots of blood was transfused. Albumin, the protein was transfused, and he was prepared for surgery on Tuesday. When his BP was a little better, his fever was controlled, and then we performed him. We performed 2 surgeries on him. Tuesday 17th February 1st, and then after that 1 week later second surgery. The wound was not very great when he came to hospital. There was some dead tissues. There was organisms where the wound was infected with organisms which are resistant to multiple antibiotics. So we started him on very broad spectrum antibiotic, and his infection is getting under control. Now his wounds and his general condition is getting optimized for further surgeries, which will be skin grafting. The skin from his good areas like thigh will be taken, and the wound will be covered with the skin graft, and so that all the wounds heal. He also has multiple fractures around his both knees, which we had consulted with our orthopedic surgeon, and he said these fractures are not very severe, and he can be treated conservatively for that. And now he is being mobilized with the help of physiotherapist. He was made to sit yesterday. He was given an attempt to stand, but as the wounds are so extensive, there is he is in severe pain, so he is currently reluctant to stand, but he should be able to stand very soon, and we should be able to cover his wound and make him heal very soon. He has a good prospect. Thank you.
Afternoon. My name is Rajiv Kishore Mehta. I'm a permanent trustee of Lilavati Hospital. I'm holding this conference today because there are a lot of misconceptions in the press and in the media created by certain vested people, which I want to clarify today. There are a couple of points which I want to clarify. One is first the issue of Mr. Yogesh, who has been admitted in our hospital, whose treatment has been done at our hospital. I would like to clarify certain things about him. Mrs. Deepa Shinde will tell you about him.
Thank you. Thank you, Rajiv bhai.
माइक बघा, माइक घेऊया. ऑन करा.
Lower limb, there is for that matter no skin right from mid thigh up to ankle. So literally there is no skin all around the thigh and leg. So and there is infection which requires 3 to 4 antibiotics, broad spectrum antibiotics, 3 to 4 times a day. Also, there is another wound on the right side, right leg, from just below knee to mid of the leg, and the extent is not as severe as on the left side, but it is also a big wound, and the infection is getting controlled, and it will require skin graft. We have done 2 sittings of debridements and back dressing. Debridements includes removal of dead tissue, washing the wound with the antiseptic solutions, saline, and making it infection free as much as possible, as much the infection is visible through naked eye. And the back dressing, which is a special kind of dressing, vacuum dressing, is applied to the wound so that whatever dead tissue secretes swelling fluid or bad fluid, which is it is absorbed and it is taken out of body, so that the wound remains not in contact with the environment, and it becomes easier for it to heal well, so that we can put skin graft and it will be smooth skin.
Like that. I'll also like to make a statement at the onset. We have got a Bombay High Court order against Mr. Paramveer Singh for making any further defamatory statements against Leelavati Hospital and the trust. The matter is sub judice, and that's why I can't talk much about it. But we have got this order restraining Mr. Paramveer Singh and his scandalous statements he's made in the press.
ये लोग का ये ना सब मारने का भी जो चलता है